sir? I have arrived, and I apologize for the late arrival. But I went up
not too bad, half an hour. I want to meet the new president of the Chamber of Commerce.
I know the gentleman, I've met before, I know the gentleman very well. One of the outstanding citizens of this community.
One of the old citizens.
I'm Elaine. Well, we've met at Miguel's party several times. Yes, lots of times. Yes, nice to see you. And I am also DAC chair. So, Nola's chair.
Hello, sir.
I'm Ken Rooney from the Rotary Club here in Negril.
Yeah,
you can stop on
What we'd like to do is maybe just take you on a tour to show you what the clinic looks like and some of the challenges we have. Elaine has a background in emergency medicine.
I've met him at lots of parties.
Okay. So we'll just walk with you and then afterwards you could say a few words. And
yeah, okay. Sure. All right. So who's leading?
Well, I was a nurse.
Hello. How are you?
That's Mrs. Hammond. You remember? Yes. And Daniela was chamber manager. Yes. And Tamicia, our plaza manager. And her sister. Yes. The first thing was when I came in and I saw where the nurses had coffee. Being a nurse, a registered nurse practitioner myself, and I came and saw where they sat to have their coffee break was a total disaster. So with the chamber and Mr. Issa, we actually remodernized it. We put them new covers, and we've done all this for them. But it's hot, and the state of their washroom in there is a total disgrace. I mean, they cleaned it up now. We have their storage there. So, and then this is their storage, and here are all the stalwart, hard-working people. Yes.
Very good. How are you? So you're the leader who runs things here? One up,
more or less, yes. And this is their area. It was terrible, but they got some new chairs. They had like wooden benches, and it's like a sauna.
It's always like this?
Always.
Without a ceiling?
Always. Then it's like a sauna. They are working it. And then they have all the little rooms going on. So they convert the rooms as they go along into whatever they need.
Right.
So it can become a doctor's office, a vaccination room, whatever. Come down here on like a Wednesday. Yes. Babies, pregnant mothers, everything. And the Sandals, this was a garage here. And the Sandals Foundation, because they need so much space for rooms and things, that the Sandals Foundation did that. It was leaking when I came in once here, and so they came and repaired it.
Oh, very nice.
Yeah, so they came because they put that just to do the garage, and so you can feel how hot it is. And this is just another room as well, where they do doctor's office, yeah. So
What's that next door there?
that's, you're going to look at that. That's, I run a little charity clinic where we put braces on kids with deformed feet, the neglected part of the society. Daniel.
We had asked him, he would like a new clinic with a mini trauma center, man 24 hours a day, 7 days a week. And he came back to us with this. This was done by your ministry. And then when we asked him, well, what would this cost? I don't know. He said it's going to cost us about $150 million. Well, you know, so going on his word, and then he brought a letter, it was not signed by you, but endorsing the Adopted Clinic program.
Right.
And that's when we went ahead and started the building fund for this project. And we are determined to reach that target, if that is the target. But I think we would probably like to sit again with your technicals
Yes.
and go over it. I mean, we have certain ideas of what we would like to see in the grill.
Right.
And along with how you see these rural clinics operating, taking pressure off the regional hospitals.
Right.
And, well, this was the drawing that came,
Right.
and this was the basically. I think the plans are with the ministry.
Right.
Yes.
Yeah,
So the first thing I'm going to do is inquire about the plans to determine if the actual bill of quantities or the costing was properly done.
Yes.
And on what basis was the determination on what the clinic should look like, because
Right.
it has to feed back into the other services. Now, Negril is a special situation because of the tourism and so on. And clearly what you have here is insufficient because it's certainly requires upgrade and maintenance. So what I'm going to do is ask the team I'm going to review this and determine how much of a cost they actually have. And then we feed that back to you.
Yes.
In any event, fundraising is going to be necessary because
Right.
this is not what you want.
No, we want to bring it into the first one.
But sir, one of the things when you're looking at it, we need to know, because we're not building it for tomorrow. It's like for 20, 30 years down the line. And we don't want it to be added on, so it looks, as it. So we are hoping that the ground level would be strong enough so it could take an upstairs, so some offices could go upstairs. So we want to, so we want to look at it in that sense of a futuristic, so we don't have to go and rethink it again.
Well, again, the clinical people would have to assess based on the demand
Right.
of the system, and then the technical people would, So let me find out exactly who had done that,
Right.
and what was the justification for what was
Right.
there, and then what the actual costs are. But we are committed to upgrading the facility, working with you,
Yeah.
try and make sure that we have a better facility in these plants. Because I agree with you, there needs to be the kind of infrastructure to support the population and the community here.
Right. And it's growing
Yeah, well,
daily.
of course.
So we are looking futuristically rather than
Yeah.
right now.
So you said Shakir gave you this?
Yes.
Yes.
Yes. He got it from the ministry.
Would you like to take that or?
No, you keep it.
original,
Yeah,
and this
yeah.
is the plan.
Yeah. Okay. And you certainly have the land.
Yes, it goes a bit
Yes.
back.
Yes.
Right, yeah, so that has space.
This is an expanded and renovated health center.
So we actually need the foundation to be solid, so that we can go up if need be.
Well, this is it's a slab roof. Parts of it.
Part of it is zinc.
Zinc.
And I think it has to be, part of it has to be air conditioned.
Yeah, no.
So we have to look also putting solar, do a solar, because we need to cut down costs as well. And if they are going to run the ACs 24/7, which they will need to do, we need to think of solar panels.
All right, so I don't want to micromanage the process at this time.
Right.
Yes.
Yes,
No.
of course.
What I'd like to do is to get the clinical people to tell me exactly what determined how much they were going to do and what in terms of the expansion. Once that is justified,
Right.
and we're together on that, then we determine what the actual cost is. But to the extent that I can help you with some of those fundraising efforts, I'm more than happy to.
Great.
And I laud your efforts.
Right, and sir, I would like you to
Raise
talk to
those
Mr. Cooney from the Rotary Club, because Rotary Club of Negril would like to come in on
Yeah.
the project.
Clearly is a fair distance. And frankly speaking, in a case like a resort town, where you have so many more persons apart from the citizens passing through, it would be important to have a facility that serves the purpose of. And so, and from that perspective, I think it's certainly worthy of consideration. But I would want to engage the clinical people to look at it. What is very clear is that this is not sufficient for what you have. So we have to do something. So it would be important to do something. The extent to which what we do, I'll examine that and find out on what cases was done.
Because bear in mind we only have one ambulance as well, so if you had a multiple accident or something, it would be able to.
But I would like to know, if Negril gets 2 ambulances also, it only stays in Negril for a week. Why has it got to be taken out of Negril?
Well,
And that happens on a regular basis.
I don't know if that is the case. But
It is, I'm telling you. It is the case. It is the case. It is.
That's the case, then we have to find out why that is the
Why
case.
it's happening. It happens. I know.
But I will work on so who is the point person in all of this now? You're the big one. I mean, you have to raise probably half the funds, you know.
Well, you know, it would be great to have matching funds, you know.
Well, that's why you have the Rotary.
Look at his shirt. It says adopt a clinic. And we're hoping to adopt a
that's part of the
clinic with
program.
his help.
Yes, but I was very encouraged this morning
Right.
at the pediatric board at the St. Anne. The minister was the keynote speaker.
Right.
And the support from the private sector was overwhelming. And I think you're going to see a lot more of it, not only here in Negril, but throughout the length and breadth of Jamaica. So we just have to do our part to try and raise the funding. But we need to get it finalized, and we need to get it costed. You need to get the bill of quantities and have it costed so we know that whether this figure is realistic or not realistic, and move forward on that basis.
But what we would need to do is to firm up on what it is that we want the end product to look like. What the vision is.
Yes.
So you can get the narrative to sell.
Right.
But I am committed to seeing the improvements and to working with the citizens.
And we are
So whatever, I'll
committed.
keep in touch with you.
Great.
Yes.
I'll let you know.
We're committed.
And thanks for coming, Chris. We appreciate it. And we also want to tell you that I want to commend you on the Adopt a Clinic initiative. I think it's a great move, and I think it's going to take a lot of burden off the hospitals in the parish, because you know that in many cases they just have a hard time coping with the number of people that visit the hospital. So these clinics, once they're upgraded and they're provided with adequate staff and doctors, are going to serve a very valuable purpose in improving healthcare in Jamaica for all those.